I'm Nils. Hello.
Hallo.
Hallo, hallo.
Ja.
Hi.
Medicines Sans Frontiers, MSF in short,
is a cooperation between international field workers and national staff.
Working together in the field operations.
This ensures that the medical effort put in by MSF is relevant and effective.
The charity operation is no exception.
Here, staff members from all over the world is managing a general health clinic,
Feeding station and an emergency unit for children. However, the main focus is on the tuberculosis.
And MSF has established its own TB clinic in Charati.
Push.
You're bribing the kids.
Yes, and so that's the reason I'm so popular.
Yeah.
It is a 19 years old young girl.
Yeah.
The father has TB.
Okay.
And she started to have a very big wound in the axilla, the armpit area.
Yeah.
And it is almost 8 months already.
Oh.
And she also lost the appetite and very skinny. And the body weight is about 25 kilograms.
Wow.
Although she is 19 years old.
Huh.
Please ask the mother why they come to Charati for treatment.
maxaa dhacay maxaad halkan u imaan weydeen si gabadha loo daweeyey mar hore?
waxaan u imaan weynay aabbaheed baan joogin oo geelii la qaaday gurre la tagay ku maqna.
But the problem is that because of the limited resources, that now we can only serve the patient that have the accommodation in Charati. Because you can see we are building the TB building, but it will not be ready in 2 months. So we have no accommodation for them to stay in Charati.
Oh.
If they don't have accommodation, we could not start the treatment because they are not able to complete the whole treatment. So, is there any pain? No?
Yes.
Yes. I want to clean the wound so that you feel better here. So it is the arm. It's very waste, very thin. Yeah. So you can look, the wound is really bad, and this is some fistula with pus coming out. It's all covered with fly because the wound is pus discharging.
Oh.
Now imagine that one have the wound for 8 months, and every day you attract over 100 of fire, and imagine what kind of light it is.
But if she cannot stay here in Charati, what is the situation then?
You can see in this lady, in fact, she is very malnourished. Her consequent will die without any treatment.
Do you think that tuberculosis is a long-gone disease belonging to a different century?
Think again.
In average, someone dies of TB in Africa every 60 seconds.
However, you will not hear much about it in the news,
as this is one of Africa's silent crises.
TB treatment take up to the 8 months of daily treatment, and not completing means death.
As patients are likely to develop a TB version.
virtually untreatable with the drugs available.
And it is the female eating area. They are treated as the outpatient. They can walk and they come to the health center to take the medication every day.
Does it raise some challenges to work with women in this area?
In the beginning, the women are a little bit shy, and also the children. But for the children, it's easy because I can just keep the candy.
Yeah.
Salam.
Yeah.
It is very common when the father or mother has the TB, all the children will have the TB. And the presentation is a little bit different for the adult because for the children, they don't have the strong immunity, so that the TB will not be confined within the lung. No. They will go everywhere. The child looks healthy, but he is already on treatment for 2 months. And you can see, this side, and it is the TB lymph node. More ulceration. And we will expect the wound will be much better if we continue for the treatment. But just imagine this family, the mother is on treatment and the child is also on treatment, so they need to stay here for 8 months. Yeah.
Quite some treatment.
Yeah.
This medication that you use for TB,
Yeah.
that's quite an old medicine. Why is there no newer medication?
TB is always associated with the poor people and poor country. The poor people, poor country, that they don't have money. And I don't know if I'm right or not, because if you are not rich, then nobody is really interested to develop new medication to treat the disease. Yeah.
Though TB can be treated, it kills more than 2 million people every year.
The need for better drugs and efficient treatment are obvious.
But as long as TB remains a third world problem only, the drug companies don't find the disease lucrative enough to do the necessary development.
But the West should be aware that TB bacteria knows no border, extremely deadly and multi-resistant TB has killed people in the USA and Europe.
And TB spreads fast.
WHO is estimating that more than 1 billion people will be ineffective over the next 20 years.
Okay, this one is 34 years old. It's her 8th child,
Yeah.
and she's no bleeding,
Yeah.
but a lot of pain.